we need to protect our patients, right? That's the goal, and that was the goal behind these restrictions, is the more bodies you had going through the floor, the bigger risk to the overall population in this house. So it was very, very frustrating. It was extremely hard. It was heartbreaking. I can tell you I took many, many of those calls, as did Dr. Harold, with families begging to come in, and we tried to make as many exceptions as we could and be as compassionate. But when we had, 33 out of our 60-something adult med-surg beds filled with COVID and sick COVID, you need to think each entry into that patient's room and exit, again, is an exposure, right? They're coming in and out. We're trained. We're trained to put on the PPE. We're trained on infection control. They are not. So when we're doing our just-in-time 2-minute, this is the garb you got to put on before you enter the room, we know it's increased risk. So hope we're getting back. We've loosened a little bit. We have more exceptions, and we continue, to loosen those restrictions. But we try to stay to the Twin Cities, right? So we look at our community, but also what is this broader impact that we have. So
I would probably just add to that. We talk a lot about it in orientation. There's in a community health system like Ridgeview, there's not the phenomenon of 6 degrees of separation between, you knowing a stranger. There's probably 2 or 3 degrees of separation between knowing the people that we're caring for in this community. And so trying to convey that our policies are really around keeping you safe. And so looking for some understanding during a pandemic was really a challenge for us to convey to our friends and family that had loved ones in our facility. But again, to Elaine's point, it was about keeping them safe, as much as anything. And we did have compassionate care policies. Yes. Where if somebody was, doctors and nurses know when people are not going to make it usually. And so when those scenarios were about, we certainly let families in and had people there appropriate to be able to say their goodbyes in those compassionate settings. But it was a big challenge, and kudos to Elaine and our nursing staff who had to amend some of their policies for visitation.
And I'd like to add to that too, just to commend our entire staff, but particularly the nursing staff. As a physician who's in the hospital every day, seeing patients every day, the patients really appreciated how the nursing staff made them their family, knowing that their family couldn't be there. And I'm not sure you get that in a bigger metro hospital. I mean, this is one of the key one of the main things that a place like Ridgeview can offer a patient and their family when they can visit. But if their families can't, then we become their family, and it means a lot to the patients. And I hear comments every day about what great care they had here at Ridgeview, and I just would like to commend the nursing staff for that.
Absolutely. And Kelly, just one more thing is we also did a lot virtually. So we did deploy iPads, again, to help engage the family, and our nurses would go in and connect with family members so that the patient and family member could stay connected.